Hi, this is Dr. Stephen Katz, owner of the alternative medical clinic based in Scottsdale, Arizona called Naturopathic Physicians Group. I co-host the show alongside my co-host, Dr. Loreena Ryder. We are naturopathic physicians, and we're here to help you navigate your journey to wellness, but we like to do it simply, without all of that horrible medical terminology that everybody hates. We're here to provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, come see us at Naturopathic Physicians Group to help get your life back.
Hi, Dr. Loreena Ryder here. So what is a naturopathic doctor anyway? Are you a real doctor? These are the questions that we get from patients or just anybody. Yes, of course we're real doctors. We provide primary and specialized care for our patients. Basically, we treat your symptoms by investigating the source of those symptoms. For example, let's say you come into our office during the initial intake, which takes about 1 hour, and we're asking about your GI health just because that's one of the things we cover. You say, I get heartburn when I eat, but I really just want to get my knee pain fixed. So instead of giving you an antacid, we'll investigate why you're getting heartburn in the first place and what is causing it, and we'll also address your knee pain. And we'll do it naturally and extremely effective.
Yeah, and I love when I get the question, are you a real doctor? I wear doctor on my shirt, and I tell them, no, I just do this for fun.
Yeah.
We go to medical school 4 years, long time, and it felt like 135 years. Mm-hmm. You agree?
Yeah, it was awful.
Yeah, I aged a lot during those years.
Yeah.
But it is what it is.
Yeah.
So every week we do a different show, and this week we are doing hair loss, also known as alopecia. Did you know the average human has roughly 100,000 hairs on their head?
It's a lot.
And then I have about 25,000? No, I have more than that. I counted every single one of them. And I have close to 100,000 hairs on my head.
Is that what you were doing in the mirror the other day?
That's right. I was checking. I was plucking each one of them, making sure I didn't lose them all. I'm married with kids. I'm lucky to have any hair left. But every day we will lose around 50 to 100 hairs, strands, naturally, and that's normal. But if you start losing more than 100 hairs per day, and again, very difficult to physically count this unless you are extremely OCD and want to, but if you start losing more than 100 hairs naturally per day, that can be a sign of a problem. Longer-haired individuals generally complain more about this than short-haired people, although short-haired people will as well. But long-haired people generally pay more attention to it.
Well, and so do the people around them as well, because they'll pick up the hair and lift it up above their head and look at it and then look at you because they know where it came from.
Yeah, if you're shorter hair, you're kind of used to it. Those are the kind of people, and I'm guilty of this too. I've always kept my hair pretty short. I'll look in the mirror and be like, all right, I'm going to get ready now. Done.
Jealous.
And then I'll watch my wife who'll, spend time, and then she'll look at me and be like, you're so lucky you have this. And I'm like, yep. Mm-hmm. But longer-haired people tend to spend a lot more time on their hair. And when you have more time, it's way more noticeable. If you're looking in the sink, if you're looking in the shower, you're going to see those longer strands versus with me, you probably can't see. It's too small to notice.
Right. Yeah, and your hair has an average lifespan of up to 6 years. So that's your hair growth cycle that we're talking about. And every hair strand will go through this cycle just like a cell in the body. And when one hair strand sheds, then the new strand is supposed to appear behind it to replace the old. It's like skin cells as they regrow.
The key word is supposed to.
Right, yeah. It doesn't always happen for many different reasons. And people have different widths of hair too. Like my sister-in-law used to tell me I have skinny hair. She's like, how's your hair even skinny? But it's not very thick. And I think the number of hair strands differs on people so much. It's just a range.
And I was always told I have really thick hair, but then as I aged, I started noticing I was growing the curly from the Three Stooges. Sorry, the Larry from the Three Stooges, where I was getting a lot less growth on top but the thickness on the sides was still there. Mm. Very, very noticeable.
Lucky you.
Yeah, but generally females will pay a lot more attention to their hair than men will. Therefore, females tend to complain more about hair loss than men do as well. But if you start getting those male pattern baldness, you start getting the George Costanza, then it becomes more noticeable, and then men start to pay attention to it. But most of the time, men don't even pay attention to it until it starts affecting their dating.
Somebody starts talking about it.
Yeah,
They're
then they start
comments.
paying attention to it.
Yeah, the most common symptom you'll experience is just that gradual thinning of the hair on top of your head. You can also have like circular or patchy bald spots. That's very noticeable. A sudden loosening of the hair at the root, people notice that because they say, my hair's just coming out in clumps. You know, when I wash my hair, I brush it. And then you can also have full body hair loss. So eyebrows, arm hair, leg hair, that's a form of hair loss as well. We're not just talking about the head. And then also you can have patches of scaling that spread over your scalp as well.
So there are lots of causes to hair loss, and we're going to get into a lot of them today. The most common by far, in a way, is family history, hereditary. It's called androgenic alopecia, which can be male, but females can have this as well, pattern baldness. So this tends to happen right at the top, the crown, and it also spreads to the sides around the temporal area on the side. So the sides to the top is the most common place for this to happen, generally more in males than females, but can happen to both. This is known as a gradual thinning of the hair. So this isn't going to come out in full chunks. This is going to be, you just notice every time you get a haircut, you get the same haircut every time, but you notice less and less hair is actually coming out every single time you do it. This is actually happening when the follicle where the hair comes out starts to shrink. The most common cause of this for men is going to be testosterone, and the more testosterone, if it's producing something called DHT, which we'll get into a little bit more detail later on, but if it produces DHT, it will block that follicle's ability to allow hair growth. And since men have more testosterone than female, in most cases, they are way more likely to have this cause.
Also, hormonal changes can be to blame for hair loss. Your thyroid has a lot to do with it. And so your thyroid can be either high or low. It can be hypo, which is the low functioning thyroid, and that will produce dry and brittle hair, the hair that just kind of breaks off. It doesn't matter if you're brushing it aggressively or not. Hair loss can be seen on the head, but you can also tell with the eyebrows. That lateral third eye of the eyebrows is pretty much a telltale feature. If you've lost that, if you only have a portion of your eyebrows that you used to in pictures 20 years ago, you know, you might want to get your thyroid checked.
And that has to be naturally losing hair there, not going to one of those plucking centers and having it done.
Or plucking it yourself. That's a thing too. Yeah. And the thyroid hormone thing, that's huge. Other things you might see there is fatigue, dry skin, just all over dry skin, constipation. There's so many thyroid issues that we can talk about. And your thyroid can go the other way too. It can go hyperthyroid, but we'll talk about that here in a minute.
So every week I do a segment called What Isn't Your Doctor Telling You? This is not an anti-doctor segment. This is just an information segment to where you can learn something that you might not be able to find out in your 3-minute appointment you have with your conventional doctor. So this week, have you heard the phrase, pull one's hair out? I kind of assume everybody at this point has heard that phrase, or you're making me pull my hair out.
You sound like my mom when I was
I
little.
sound like probably every adult ever that's had kids, because they always make you, or anybody who's ever had a job, you're going to have a boss. I mean, how's your boss?
I like my boss.
Oh, that's good. I like my boss too. My boss is my wife. But that phrase, you are making me pull my hair out, is often used to describe stress or anxiety when dealing with a difficult situation. This actually stems from a real medical condition known as trichotillomania. Trichotillomania. This is categorized as a real mental disorder that involves intermittent and recurrent urges to pull out your hair. Again, kids, trichotillomania. The funny thing is about this, it's not really even funny though, is that this is a real thing. People will have that need to pull out their hair, and it's not always the top of their head. It can be their eyebrows. It can be other areas of the body as well. This affects up to 3% of the population some point in their life. That means 3 out of 100. Doesn't sound like a lot, but it actually is a lot. Think about 300 million plus people, which means there's going to be millions of people that will actually suffer from this at one point in their lives.
Mm-hmm. Yeah, it's a very true condition.
So it's definitely something next time you say, oh God, I need to pull my hair out, you might be offending people. Well, in this world we offend everybody with everything, but you might actually offend somebody who does pull their hair out.
So we were talking about reasons why hair falls out, and hormonal changes was one of them. We left off at hypothyroidism, but let's talk about hyperthyroidism. That's an overactive thyroid. And that's when thinning and shedding of the hair just leads to the hair loss. And then also you might see other hyperthyroid symptoms. So with the hypo, you saw fatigue, dry skin, and constipation, but with overactive thyroid, you're going to see anxiety, heart palpitations, and diarrhea. And so kind of the opposite picture.
Yeah, basically, if you have hair loss and you don't know the reason for it, it's probably a good idea to get blood work done. As you age, females will go through something called menopause. It's very common.
Why don't they call that womenopause? Why is it menopause?
I don't know. Because men go through menopause.
Yeah, they do.
So womenopause. We'll call it womenopause. We'll start the movement. But basically, as your body gets lower estrogen in the body, it will cause hair loss on the head as well. And so when they go through menopause, that's a very common cause for hair loss. And one of the biggest complaints on why a woman in menopause will come in. The hot flashes are a big one because they feel like they're on fire while they're sleeping or throughout the day. They just get these random bursts of fire. But probably the second most common cause a woman will come in with menopause, it's going to be hair loss.
Yeah, those two things that'll bring people into a doctor's office real fast.
And scalp infections, these are one that are true to my heart because I have gotten scalp infections from haircuts in the past. Somebody clipped my hair a little too close, cut my head, and got a big abscess from it.
And then somebody else had to drain it.
And that was not fun either. As much as
It was fun for me. What are you talking about?
I've had it done a couple times. It's always fun for the doctor to do the draining of the abscess. It's never fun for the patient, but it's real. Mm-hmm. I got a bad scalp infection from a bad haircut, and I lost a chunk of hair where that abscess was. And this is not an uncommon way to lose hair, but this, of course, is going to be only hair loss at the site of the abscess. Mm-hmm. And once the abscess is cleared up, it might take some time to regrow that hair, but once the abscess clears up, you're able to grow that hair back.
And when you have short hair like you can't cover it up. It's not like you have long hair where it'll fall over it.
I didn't even know I had it the first time. My assistant in the office walks up to me and goes, you have a patch of missing hair on your head? I'm like, I do? She's like, yeah. So then she shows me, and I had this giant, just gap, and I was like, oh, shit.
Yeah. Yep. So we had to take care of it then. Another reason that you can have hair loss is COVID-19. That's a big one in the past 2 years, and we're still learning about this. But there's also something called long COVID, whether that's recognized medically where you go or not, but it can prolong that hair loss, and it can remain, you can be losing hair for months. There's other things that go along with that, fatigue, so on and so forth, but that is something that a lot of times it will come back after a COVID-19 infection, but sometimes you do continue to lose it.
Other very common medical conditions, diabetes pretty much causes problems throughout your entire body. Hair loss is also one of them. It actually interrupts, the blood sugar elevation will interrupt the process or will slow down the normal hair growth cycle like we talked about earlier. So this will happen if you're diabetic. You'll lose hair all over your body. It's not just going to be on your head. You're going to notice it in men, especially in their legs. They'll notice a lot less hair growth in there. They'll have little hairs here and there, but they'll be missing most of their hair in their legs.
Lupus is an autoimmune condition that can also cause you to lose hair. This is a widespread inflammatory disease. It does involve your skin and scalp, which generally causes the hair to fall out and thin, and that affects body-wide hair, so eyebrows, eyelashes, beard, body hair.
I mean, autoimmune is going to be attacking your body, so any type of autoimmune condition could have some form of hair loss. There actually is an autoimmune disease to where your body is attacking the follicles of your hair, and it's called alopecia areata. And this, again, your own immune system is attacking the actual area where your hair growth is supposed to happen. So this is, you will lose large clumps of hair all at once. And this is rare, but it's possible that you could become totally bald because of this condition. Or it could be even more rare, but possible, is there's something out there called alopecia universalis. Universal, whole body. Basically, you get no hair on your entire body.
I know somebody who has that.
And they did a movie called Powder, I think.
Yes.
I think he had no hair, too.
Yeah.
He had other things, too.
Right.
And then he got electrocuted by lightning.
I've never seen that movie, but I just know about it.
I just know at the end he gets electrocuted by lightning.
Okay.
I don't remember anything but that because that was towards the
This is
end.
the best part.
I mean, I was like 12, I think, when it came out or something. So I thought that was, I was like, that's cool.
Mm-hmm.
It's probably not cool, but
Yeah. So most people know that cancer therapies can also cause you to lose your hair as well. There are estrogen blocking agents such as tamoxifen and anastrozole. This lowers the estrogen in your body, and it can also increase testosterone, and that DHT that you were talking about, it would be a DHT dominance. Radiation therapy can also damage the follicles of the hair, and this can actually be permanent. A lot of times the hair will come back though. And then chemotherapy agents, cyclophosphamide and doxorubicin, the chemo actually damages the fast-growing cells in your body, and hair follicles fall into that category. Hair typically grows back again within a few months post-chemotherapy.
and probably the most widely talked about reason for hair loss other than male pattern baldness or menopause is stress. We all say, oh, again, we talked about the condition to where you lose your hair because you pull your hair out. But stress itself can just cause hair loss. There's a thing out there called telogen effluvium, and this is typically reversible, in which your hair starts to fall out due to an extremely stressful event. So this could be a family event, a trauma, divorce, loss of a loved one. Something major goes on in your body, and due to this stress, your brain will go into survival mode. And when that happens, it will want to conserve energy where it's less needed. And in your body, it will think the hair growth area is less needed for survival. Therefore, you'll literally just start losing hair.
Yeah, this really freaks people out. And it is, most of the time, it comes back within a few months. But yeah, they'll come to the doctor and say, I am losing my hair. And when you do your full intake, make sure there aren't any other reasons that we talked about. And then you'll say, okay, did you have a stressful event in the past few months? And then that's what helps determine.
And it'll be like, who doesn't?
Well, yeah. This is a major stressful event, though. Most people can pick out that one thing, right?
There's usually a big one when they start losing hair in clumps like this, when it's caused by the telogen effluvium.
Right.
But now, self-inflicted hair loss, other than pulling it yourself, what can have been, there's a thing out there called traction alopecia. This is for the people that love to hairstyle their hair. You tight hairstyle, we want to make it really, really tight, like ponytails or chronic hair braiding. This will increase your chance of hair loss. So when we're pulling our kids' hair and making them into ponytails so they can look all pretty for pictures, you're causing them hair loss. Stop it. Just kidding.
Yeah. They don't really like it anyway.
No. Who likes their hair being pulled?
No, I didn't, that's for sure.
But that chronic tension causes hair loss. And this tends to be, well, think about it. If you pull your hair back, where are you going to feel that? You're going to feel it on the temporal scalp, the sides of your hair, where you're getting pulled back all the way to the bottom of your hairline.
Mm-hmm. Also, using chemicals and color on your hair, we don't recommend, but that can be harmful to your hair if done on a regular basis. Anything like hot curlers, straighteners, hair dryers, that heat weakens the proteins in the hair, which makes it weaker and more brittle and more likely to fall out. Kids, I hope you're listening. And then a common question is whether or not to wash your hair every day. Is that good for your hair or not? And the answer is yes and no.
I say yes because I don't want to stink.
Well, that's a good thing. Not stinking is a good thing. But if what you're using on your hair isn't toxic and doesn't damage the hair, then that's fine. But it's a good thing if it cleans and cleans the dirt off your scalp, because if you leave dirt on your scalp, it clogs your pores and the follicles, and then it stunts your hair growth.
So like every answer you love, the answer to that question is yes and no.
Right.
Yes or no.
Everybody loves that answer.
We love that answer.
Yeah. So thanks again for tuning in to our weekly show, Your Health is Wealth. We're the doctors from Naturopathic Physicians Group.
We're here to help you take charge of your life and get your life back on track. Today we are talking about hair loss.
Dr. Ryder here with your tip of the week, and I would like to talk about hair brushing. To brush or not to brush, that is the question. So back in the day when old-time movies showed sisters, moms, daughters, and friends brushing each other's hair, I always thought that was really cool to watch. It looked so relaxing and nostalgic. So brushing hair stimulates blood flow at the scalp, which releases oils, promotes hair growth, strengthens hair follicles to hold on to hair. However, Studies show that if you're actively losing hair, this is a bad idea. So reducing brushing frequency may reduce your amount of hair shed. That's what the studies say. The American Academy of Dermatology says that losing 50 to 100 strands of hair per day is normal. You said that earlier. I don't know if I fully agree with that, but we're going to go with that because that's what they say is normal.
I'm not going to count.
Okay, good. But bottom line, if you're actively losing hair, it would be wise to reduce the frequency in which you brush hair. If you have a full, healthy head of hair, brush away. It stimulates it for growth.
I mean, when I used to watch those scenes where they were brushing hair, I'd just be like, God, here comes something drama-filled, boring, and when can we get back to the action and have fun in the show again?
I can believe that you would think that, of course.
So we were talking about causes. There's so many causes of hair loss, so we'll get into a couple more, and then we're going to get into treatments. But poor nutrition is a huge one. If you're not getting enough nutrients, or you do one of those crash diets, or you do one of those really bad diets where you're doing like anorexia, your starvation, or bulimia, where you're doing the vomiting after eating, this will cause micronutrient depletion and macronutrient depletion, which will definitely be linked to hair loss. Mm-hmm. There's also iron deficiency. If you have iron deficiency or iron deficiency anemia, which is low red blood cells caused due to low iron, this causes the integrity of your hair to weaken as iron is needed for the hair strength. So you will likely have hair that will break and shed.
Mm-hmm. Zinc deficiency is also to blame, just like the iron that you were talking about. It weakens that integrity of the hair and it can break and shed. And also a protein deficiency. Proteins build collagen, right? So if you have less collagen, then that means you have weak hair and less hair growth.
And the one everybody hates to hear, age. As we age, we are more likely to lose hair, not necessarily because you're shedding hair faster. It's that it becomes slower to regrow the hair. So you just don't heal as fast as we age, therefore you will lose hair.
Yeah, bummer. Testosterone or DHEA therapy.
Sucks.
It really does. Men and women are affected by this. So testosterone, like you said earlier, can convert to DHT, and that shrinks or tightens the hair follicle. And then you have general hair loss at the front of the head. That's that receding hairline, everybody talks about.
And this is a very common thing for men and women who take testosterone therapy if they are low in T. So if you have all those clinics out there that are giving every man testosterone because they're like, oh, everybody needs to be like the Hulk. So they give everybody testosterone and then they start losing hair. So they're really strong, they feel good, they're green, but they're green without any hair.
They might be the Grinch, no. If they're not testing your testosterone levels while they're giving you testosterone levels, it would be a good idea to look elsewhere.
It's also an idea that they think everybody should be through the roof in testosterone, which has other issues with it. It's linked to prostate issues. It's linked to a lot of cardiovascular issues if you're too high in testosterone. So a lot of places that talk about testosterone therapy, they're just pushing testosterone therapy, and they think everybody should be much higher than they actually have to be.
Mm-hmm. Yeah, and I love hormones, but I agree with you for sure. Medications can cause hair loss as well, retinoids or vitamin A treatments, and this is easily reversible whenever you just come off of the treatment, especially when those higher doses are used, like the isotretinoin. If you're on that for acne, I think is probably the biggest cause there. Antidepressants such as Wellbutrin, any SSRIs, SNRIs, that can cause hair loss.
Every week we talk about antidepressants because they literally give it for everything.
Yeah. Yeah.
And it's linked to hair loss. Blood pressure medications like beta blockers are linked to hair loss. Well, anti-thyroid medicine, again, because low thyroid can cause hair loss. So anti-thyroid meds, if you're too high, they'll give you a drug to lower your thyroid. They're called propylthiouracil and methimazole. These will lower your thyroid function if you're too high. But of course, if you use it, you can lose hair because your thyroid might go too low.
Mm-hmm. And disease-modifying anti-rheumatic drugs, so the DMARDs. So these are drugs for rheumatoid arthritis and any other rheumatoid conditions. So this is methotrexate, leflunomide, and this stops hair follicles from being able to grow. So this kind of stops it in its tracks. And then also the anticoagulant meds that stop blood from clotting, and that's warfarin, heparin, and Eliquis.
And remember, we're never telling you to stop your meds. We're just giving you information so you can talk with your physician if it's something that could be causing your problems. But pregnancy complications, postpartum, 40 to 50% of all women that go through pregnancy will have some form of hair loss. there's usually a decrease in estrogen. And menopause, again, similar, decrease in estrogen, which will cause you to start losing hair. It could be stopping birth control pills. It could be just sudden loss due to an abortion, a miscarriage, or a stillbirth. It could be postpartum. As your body is trying to reset your hormones, hair loss can be a part of it.
Hormones are just a regulator of so many things. So let's talk more about some traditional diagnostic testing. If you go into a doctor with hair loss and this is likely what they're going to do, they'll assess the potential cause. They'll take a look at your scalp, see if there's anything going on topically, see if you have any hairs missing in big clumps or anything like that. They might do a pull and tug test.
Genius test. Like if you're thinking about hair loss, let's pull the hair, tug it, and see how much hair comes out.
I remember when they taught this in school, and it was kind of funny.
Yeah, they pretty much teach this on the playground in kindergarten because if you pull someone's hair too tight, they're going to lose a little bit of hair. But if they don't lose any, then they have really good hair.
Right. Yeah. So let me tell you, I don't know how they would test yours. Yours is like a quarter of an inch long.
I just got a haircut. Don't judge.
Use some tweezers. You'll want to get a basic thyroid check done. And when I say basic thyroid check, that does not mean just a TSH. That is not a full basic thyroid check.
Conventionally, they usually only run TSH and then they tell you what's wrong with your thyroid, but you need more than just TSH to actually see what's wrong with your thyroid. You need your T4, your T3. If there is any historical issues or autoimmune, you want to check the antibodies to thyroid because all of them could be linked to your hair loss. Same thing with testosterone. You want to check your total and your free testosterone so you know your active levels. You want to check estrogen, but there's certain tests out there that actually measure all types of estrogen, which are just as important as just the E2, which most doctors only run the E2.
Yeah, a lot of times people don't know that you have more than one type of estrogen. There are several different types, and it's important to know that. Also running a CBC, which is a complete blood count, and an iron panel. I wish iron panel was done on regular yearly blood tests at a traditional medical doc, but it's not. It's super important to check for anemia and or iron deficiency.
And if you do have a history of autoimmunity or suspecting any autoimmunity, there's an ANA test out there that assesses for a lot of different autoimmunities. But now into traditional treatments. As we say each week when we discuss both traditional and naturopathic treatment options, we are not giving medical advice. We're giving you information that you can use to discuss with your practitioner on your best options moving forward with your health.
There's always wigs. You know, if you have major hair loss, there are wigs out there that are made out of real human hair. But there's also Rogaine. Most people have heard of Rogaine as a foam or a shampoo. It stimulates the hair follicles. You use it once daily for women, twice daily for men. And initially, it might cause hair loss at the beginning, but it should cause hair growth as time goes on.
And there's also the tablets. There's 2 FDA-approved hair loss tablets that are capable of helping restore your hair, Propecia and Finasteride. These work by blocking that testosterone from converting into that DHT. So this doesn't work as well for men over 60, but under 60 it can help. And then, of course, you have hair transplant surgeries where they like to take hair from one area and put it into another. And there's a couple tests we want to talk about today. One is called, it's just a full adrenal profile. So this is usually a 24-hour urine collection. And your adrenals are what's responsible for both your sex hormones like testosterone and estrogen, as well as your stress hormones like cortisol and cortisone. So when you do a full spectrum adrenal test, you can see how your body is balanced between the testosterone, the estrogen, and your stress hormone. This allows you to determine if hormones are part of the issue causing your hair loss, and that's huge. And the good test will also run that DHT, that thing that converts, that is linked to hair loss specifically in men, but also in some women.
And those are easy tests to do. They don't involve a needle prick. That's either urine or saliva.
Peeing all day long.
Or spit in a tube. You can do that 24-hour cortisol that you spit, test it 5 times a day.
That song, all night long. You just got to pee all night long. All night.
Right.
All night long.
Oh my gosh. Okay, so let's talk about some naturopathic treatment options. We're naturopathic doctors, so we treat the cause. So if you have a thyroid problem, treat the thyroid. If you have iron deficiency, guess what? We treat the deficiency. We give you iron.
Mind blown.
Right? So simple, but so effective. If you have high stress, treat the stress. And that's a little bit easier said than done.
It's not always easy because you have to be able to identify the stress, but also you're not always able to remove the stress. If you have a problem at home that's causing your stress, you can't just go home. Well, you can, but generally you can't just go home and say, get out. It's not that simple sometimes.
Mm-hmm. Yeah.
It's not.
I get it. And I sympathize
with
people.
When I go home tonight, my wife will not look at me and go, get out.
You'll say, no, that's too much stress.
Too much stress.
And we talk about diet every week, but really great thing for hair is fatty fish because it gives you those omegas. And the wild caught is always better. So mackerel, sardines, salmon, and small fish. I mean, fish used to be the ultimate health food, but because our oceans are getting more polluted, it's getting pollution into the fish. And I won't talk about that right now. It's disheartening. But this works. The omegas work by increasing the thickness of the hair shaft. So that's beneficial.
Yeah, berries for high micronutrients. So we always say berries are yummy. They are good. They're really high in vitamin C, which is necessary for collagen formation. So collagen is necessary for improving the density of your hair. It improves the blood flow to the follicle, which means that it will help with hair growth as well.
And then iron-rich foods. Gosh, I love iron-rich foods, especially for premenopausal women. So women who are still having a menstrual cycle. But basically lean beef, beans, green leafy vegetables, tofu, eggs if you're not sensitive to them, which a lot of people are, but the list goes on and on. And then teas, believe it or not. Hibiscus tea is used in India as a remedy for hair growth. It actually, it improves the hair at the follicle level and increases that growth.
Yeah, they've actually done studies that showed hibiscus benefit at hair growth. They've also done studies on green tea. There was a study in 2005 that showed that the antioxidants in green tea decreased hair loss.
That's good to know. I actually didn't know that.
Of course, organic green tea, not the garbage that's 25 cents and here's your cup and go get it from the fountain.
Filled with sugar, right?
Filled with sugar. Yeah, that ain't going to be good.
Yeah. Good quality proteins are always great. They're rich in amino acids like cysteine and lysine, and that's necessary for healthy growing hair. They build blocks of collagen, which is good for hair, skin, and nails.
And every week we got to be mean to a couple foods. So dairy due to inflammation and the common cause of skin issues, including skin issues on the scalp. And gluten and other sugars, highly inflammatory, definitely increase your risk of autoimmune diseases, which of course have linkages to hair loss.
Mm-hmm. And smoking. If there isn't enough reasons to quit smoking, a 2020 study showed that a significant correlation with smoking and hair loss. There were 1,000 men in the study, and the majority of the smoking group had some form of hair loss. Less than half the men who didn't smoke had hair loss.
Now, a treatment we do in the office is called PRP microneedling. So PRP stands for platelet-rich plasma. So this treatment, we draw your blood, we separate your platelets, your healing cells directly from the blood, and then we microneedle them on your scalp or anywhere you have hair loss that you want to do. If you have damage to the follicles, PRP microneedling works really well at healing the damaged follicles, which will allow your hair to grow better. Now, if it's due to low thyroid function or low iron or other issues, then the PRP microneedling is not going to do much because you have to treat the cause. But if it's due to aging and damage to the follicles, PRP microneedling can be a game changer for a lot of people at restoring their hair.
Yeah, it's a great treatment. Low-level laser therapy or cold laser therapy is an FDA-approved modality for hereditary hair loss in both men and women. It decreases inflammation in the hair follicle and improves that hair density.
And who doesn't like a scalp massage? Who doesn't like somebody coming up there and, playing with their head? It's generally feels pretty good. Mm-hmm. I know people who don't like it, but in general it feels pretty good. Well, they actually did a Japanese study in 2016 that showed just a 4-minute scalp massage every single day created thicker hair after 6 months.
Yeah, and those it's kind of trendy now, those natural bamboo hair brushes. They're out there that you can just kind of rub them through your scalp for a scalp massage.
But we can take those scalp massages and make them even better. Why not? So why not consider applying some essential oils to the scalp massage? You can put some of these essential oils on your hand and then scalp massage those onto your head, such as peppermint oil or rosemary oil. These are used traditionally because they help improve blood circulation. So if you improve blood circulation to your scalp, it can help with hair growth.
It smells so good. Aloe vera you can apply topically. Also coconut oil you can apply topically. These actually help the follicles be healthier and help hair growth, and also reduces dandruff at the same time.
And we go into supplements every single week that are amazing things to use potentially, but of course, talk with your doctor before. And if you don't have a good doctor, come talk with us. But collagen, we've talked about this before when it's pain. We've talked about this before for skin. But again, collagen is the building block to connective tissue. So it's really good for your tendons, your ligaments, and joints, which is great for pain. But it's also really good for hair, skin, and nails. And since we're talking about hair today and the skin, the scalp, it's an amazing supplement you can use. But not all collagens are created equal. You want to get a clean one. Basically not American cows because they're all full of toxins and chemicals and hormones and all that other stuff. So basically you get a grass-fed, organic, clean collagen. It comes from beef, it comes from chicken. Those are the two main sources, but collagen can be a game changer. Almost everybody I know who does collagen will say, man, I definitely notice my nails are better, my skin's better, my hair is better.
Less pain. Biotin is vitamin B7. That's typically what you see in those hair, skin, and nail supplements that you buy on the shelf. This helps build connective tissue like the collagen you were just talking about. It can be a great vegan option for people who don't want to do collagen. This slows hair loss. It's also neuroprotective, so it can help with neuropathy. It's good for mood and energy as well. There's so many things that B7 does for you.
Bees are good. And iron, we've already talked about iron a bunch of times, but again, it actually helps the body make hemoglobin, which brings oxygen to your follicles and your scalp. Basically, you can't regrow your hair if you're low in iron. That doesn't mean go out and buy a bunch of iron either, though, because some irons are better than others. And if you're too high in iron, you can actually end up in the ER by taking iron. So you don't want to just go out and buy a bunch of iron if you're losing hair. It's something you would want to test, discuss it with your doctor. But if you are low in iron, you will have hair loss.
Definitely. Vitamin C is good for everything and hair loss. It's necessary for collagen formation. It's one of the building blocks. It also decreases inflammation at the scalp, so it improves that hair density and the blood flow to the follicle, which helps that hair growth.
We talked about fish. Well, there's also supplements. Fish oil, again, will increase the thickness in the shaft of the hair. It will decrease the inflammation in the follicles. There's even been studies done that show women who took fish oil supplements for 6 months developed thicker hair.
Ginseng is really great for brain health, but it's also really great for stimulating the hair follicles to promote growth.
And for men specifically, but it can help women as well, but saw palmetto and pumpkin seed, which are found in a lot of prostate formulas, but these are commonly found in prostate formulas because they have similar mechanisms to the drugs Propecia and finasteride. They help decrease the conversion of that testosterone to that DHT, which will lower the amount of hair loss, especially in men.
And you can also see us at Naturopathic Physicians Group to measure your hormones, check those estrogen, progesterone levels for a menopausal woman or man if you're losing hair, to keep that hair cycle growing the way it should.
So thank you for joining us today on Your Health is Wealth, and we will see you next week.